Well, nursing school. Whilst I'm making this video, I'm already reminiscing, reliving all the euphoria, the joy of getting admission into College of Nursing Science, because that was the route I went through. And there were expectations, and then there's reality. So in this video, we'll be touching on what to expect in your 3 years of nursing program in a College of Nursing institution. So if you had expectations before you came across this video, keep it one side. Maybe after this video, you can revisit those expectations. And I also hear this common misconception with College of Nursing Science that theory is touched little compared to practicals. Like if this is theory, then this is practicals. We are about to find out. So how is nursing covered in 3 years compared to 5 years in the university? Because it's 5 years for a reason. So we'll be breaking it down from 100 level to 300 level using the institution I graduated from as a point of reference. Did I say congratulations to the newly graduated College of Nursing students? Bravo. Bravo. It's going to be your turn soon, I promise you. So let's just get into the video. By the way, Anastasia Obilo here as always. You already know if you're an OG here. If you are new here, please do not forget to like this video, subscribe at this point, join this family for nursing content, lifestyle, and the likes. If you're an OG, you know what we do here. Anyway, so let's just get into it. First year, first semester, this is your introductory class. I'm sure you're already expecting elementary courses. Oh, nobody's going to teach you anything deep at this point. Hold up. Yes, there's the elementary, but we are starting immediately. And by starting immediately, I mean your basic courses start already. Foundation of Nursing 1. Anatomy and Physiology 1. Yes. Then comes English language, use of English language, applied physics, applied chemistry, sociology, nutrition. What am I missing? ICT, information communication technology. So these are the courses you should expect in your first year, first semester. And no, there are no practicals. Don't expect practicals yet. Calm down. They are coming in their full force. They are coming, but not now. So first year, first semester, no practicals, just these courses, more of your elementary, more of those basic courses you did in secondary school, and then, some of your basic core courses in nursing science. Let's go. We're going. So you've gone through the entire semester for this course, sat for your exams. Exams are over now, and you passed. Congratulations. It is now you can officially say, I'm a nursing student. This is the time where you can boldly beat your chest and say, I passed introductory class. I am a nursing student. Yes, because that's where indexing come into place. You're probably indexed into Nursing and Midwifery Council of Nigeria. So you're a potential candidate for NMCN. Yes, you're a potential candidate for Nursing Council examination. Yes, congratulations once again. Now you can now proceed to first year, second semester. So upon your resumption, 6 weeks, the first 6 weeks, you are not going to class. I'm sorry, but no need to panic. It's a good thing. It's a good thing. You want to be a nurse. Work don't start. So for the first 6 weeks, you'll be posted to different units. You'll be posted to different units before resumption. You're not coming to class straight. You're coming, and mind you, resumption doesn't holidays in nursing does not exceed 2 weeks. It never exceeded 2 weeks. It didn't exceed 2 weeks for me. It doesn't exceed 2 weeks max. So upon resumption, the first 6 weeks, I think it was 6 weeks or 4 weeks. It was 6 weeks. The first 6 weeks we were posted to places like CSSD, physiotherapy, ENT. You may think that these places do not require so much of nursing input, but it actually does. But because we are just at the basics, these are places that the curriculum requires us to be. Like in the university, like I've heard that after every form of clinicals, when you go back, you're going for exams. It wasn't so in our case until we have exams before you sit for any clinical exam. Let's put that out there. And then there's us, which is called OSCE. You're back to class. So the courses to expect back to class in your first year, second semester are, of course, there's still your anatomy and physiology moving forward. There's still your foundation of nursing moving forward. Then expect medical surgical nursing 1 moving forward. Then expect courses like primary health care, psychology, microbiology, pharmacology. Pharmacology don't start. This is where the basics. You will be taught the basic elementaries of drugs, sources, drug calculations. The basics of pharmacology comes in here. So you've passed your exams. So we move to second year, first semester. Still expect your anatomy and physiology. Still expect your foundation of nursing. Still expect medical surgical nursing. You just started. You've not gone anywhere. Primary health care, pharmacology, reproductive health, biostatistics, and research methodology. We are in what? Second year, first semester. Work don't start. Second year, first semester, these are the courses to expect. And plus, we also go for clinicals. We'll start community posting here at this point. During my own time, we went for 2 different kind of community posting. One was like outskirts of the state where we were. That was Sokoto State. Was like the outskirts, like community. So there was a hostel accommodation provided for us there. We just had to bring our things, and then we stayed there. Went to it is at this point you just have to learn. You have to learn the basics, giving injections. I think it was at this point I started learning how to give injections, even as far as setting IV lines in second year, first semester. So community posting is always an avenue for you to learn. Like if you miss it in community posting, you missed it. It's always harder. Like, let me know your experience, but it's always harder to learn with actual patients in federal hospitals, private hospitals, like as a student. But community posting did it for us. In total, I'll say we went for roughly 4 weeks of community posting in our second year, first semester. Now we're moving to second year, second semester. And of course, anatomy and physiology is still, it hasn't ended. It has not ended. And research methodology moving forward. Foundation of nursing, of course. Pharmacology 3, of course. Research, community health nursing 1, of course. You've gone to community, you've gone for your community posting. You can now relate to these courses. Reproductive health now emerges. Dietetics, where you are being taught, dieting, diet, food. What kind of food is required for a particular patient? What kind of food is required for this patient with this condition? What kind of food can this patient with this condition take? Things like that. So you get the basics of soft diet. I remember we played with that particular word in school, soft diet, blah blah blah. We're talking about pap. They just seemed irritating. Like, God, I never want to be in a condition where this is what I have to eat, because I love food. So anyways, then we go into introduction to medical sociology, introduction to seminar presentation, and writing of term paper. So anatomy and physiology, of course. Foundation of nursing, of course. Medical surgical nursing, of course. Pharmacology, of course. Research methodology, community health nursing, reproductive health, dietetics, introduction to medical sociology. I didn't like that. I don't like that course. In fact, till date, I don't know the relations, even if it has to do with human interaction. And of course, nursing deals with a lot of human interaction. But I don't know what I was doing in that course. I'm sorry. I don't know what I did. But thankfully, obviously, I passed. And lastly, introduction to seminar presentations, which is, a form of groups everybody in that group has to contribute. One person fails, every other person fails in that group. Slides, we present. In our case, I can't remember what our topic was or what we talked on, but I can remember we're all girls and in a group, talk, and I think we did pretty well. Everybody has to contribute. Don't say you have the smartest person in your group and you do not want to make an input. Bye. You fail, the whole group fails. And you know how these teachers can be very smart. When they notice you being quiet while others are saying something and giving their input, you'll be the one to take the questions. So that's what seminar presentation, we're introduced into it, the basics of seminar presentation. We sat exams, so we sat for exams, and we also did seminar presentation with slides and what have you. So third year, the final year, you are now a finalist. Like everybody's just calling you finalist, but no be for mouth. So third year, first semester, we expect courses like, of course, this medical surgical nursing, it does not end. Like, forget about it ending till the last day you drop your pen in nursing school. Medical surgical nursing, med-surg. So there's med-surg, research projects, reproductive health, community health nursing, mental health nursing, emergency and disaster nursing, principles of management and teaching, seminar in nursing. Year 3, final year, finalists. At this point, we are going for psychiatric posting. Like, I feel like that was the most interesting community posting that we went for. It was somehow in the outskirts of town, and we had to stay in hostels, but people that were mobile, that didn't see it as an issue, coming from the town down there, I think they still went through that route. But we stayed in the hostel for most of us because accommodation was provided. We just had to bring our food and whatnot. Like, you'll be in psychiatric posting and you want to be a psychiatric nurse. Like, forget all those misconceptions you hear about nurses that are psychiatrists or whatnot. You will be in psychiatric posting and you will want to be a psychiatric nurse. I feel like it's an interesting part of nursing that you have to explore. I promise you. I don't know why I've not explored it yet, but we're getting there. Let's finish BNSC first. Let's finish that first. Then we'll know where we're going from here. Anyway, so we did our psychiatric posting, and you guys see the courses to expect in your third year, first semester. And of course, research project has started. We do research projects, binding paper, and God help you that you don't get a project supervisor that will be after your life. That will scrutinize you. Although it's for a good cause, I am made to believe it's for a good cause, just so you don't fuck up, so you don't F up during your nursing council exam, because that is what you're going to use during your nursing council, and I think you will be asked questions based on that during your OSCE examination. So I think the scrutiny is for a good cause. Yeah, I failed to mention that there's something we also do, which is called client study in our second year. So in second year, we do something called client study, where we go to the hospital, we get an actual patient with an actual condition, talk on that condition. Is a client study. You're literally talking from, who is this patient? What is his condition? What part of the system is affected by his condition? Everything you need to know in total. Management, current management of that said condition. So you are going from time to time, get updates on the management of this patient's said condition. It's an actual client study. I can't remember what my case was at this point, but it was an ENT case. So that's something that also happens in our second year. And I think that helps us to, further broaden our knowledge, because you're dealing with an actual patient. Like I said, it must be a condition that exists, that you can see with your eyes, that you can ask the patient, how is your body? How are you feeling today? That you can ask the nurse, has the doctor come to see this particular patient? What is the update on his medication? An actual client study. So If you want to maneuver that, do that at your own risk. See, nursing is so interesting. Like, nursing is so interesting. Forget all the complaints of it's so stressful. It's so stressful, but it is so interesting. Like, I love the whole process of nursing. As I'm saying it now, I'm reliving the moment and I'm enjoying it. Like, I'm so enjoying filming this video so much because it's my journey. I went through that part. So I figured I missed this part while I was editing this video. These are courses to expect in your third year, second semester. So finally, you're done with your project. Your project supervisor has done his scrutiny and says, you're good to go. You're good to go at this point. It means you're getting ready for council. So the first step is we do a pre-council examination, which would usually call, I can't remember what it was at this point, but it was a pre-council examination. I'm just going to put what we called it in our own time in College of Nursing Science, Udut, Sokoto State. I'm just going to put what we called it. So it was like, it's just like when you want to write WYEARS and you have to sit for mock. That is the same. So if you don't pass mock, you ain't gonna sit for WYEARS. So it's the same with council examination. You sit for your pre-council examination, and you passed. Voila, you look like you're getting ready for council examination. You're doing it. You're doing the big girl thing. You're doing the big nurse thing. And so congratulations, you passed your pre-council examination, and now you start for council examination. Pre-council examination is always paper 1, paper 2, paper 3, which is OSCE. The last one is OSCE. Paper 1, paper 2, and then OSCE. So 3 years is covered in 3 days. Surprise, right? But how do you know what to expect in paper 1? How do you know what to expect in paper 2? How do you know what to expect during the council examination? You thought I was going to say something, my dear? Read every single thing. If you can, then leave the rest for God. That's all I can tell you. Nobody's going to come and put timetable of today we're having anatomy and physiology, tomorrow you're having foundation of nursing. Nobody's doing that for you. Paper 1, paper 2, and OSCE. OSCE is where project comes in. You'll be asked questions based on that. And then OSCE usually has, I think, the standard for nursing council exam is 6 stations, and there's resting. I think there are about 2 resting stations, and then six answer questions and 6 question stations. So, and then there's the resting station. So that is it. And in College of Nursing Science, I think as early on as first year, we already started doing our OSCE at the end of every examination, just so that we are acquainted and aligned with it. OSCE was actually introduced the year we got into, where we're like the first set into OSCE examination. Like the set before us, they already had an experience of what it was like to do hospital exams, like go to the hospital and, you know, do your practicals with real life patients and answer questions based on what you did during your clinicals with real life patients. But we are God's favorite, and during our own time, OSCE was introduced. I hear people saying that OSCE is like OSCE, fear OSCE, but I feel like real life patients will surprise you during your exams. So if you ask me, it is a better option. So anyways, I don't know what I'm missing, because this is more like a whole chit chat already. I know I'm missing 1 or 2 things. If you're a College of Nursing student, tell me what I'm missing in the comment section. Thank you all so much for sticking with me to this point. If there are other questions you have regarding going into College of Nursing Science, please let me know in the comment section. If there are other videos you want me to make with regards this, please let me know in the comment section. I would do well to answer. Like, I'm your girl here, you guys already know. And if you haven't subscribed yet, why? Subscribe to my YouTube channel, like this particular video if you liked it, and I'll see you all in my next one. Bye.